Discover essential practices for comprehensive bathing, grooming, and oral hygiene to ensure optimal health and well-being. This course provides essential training in assisting patients with activities of daily living ADLs, focusing on bathing, grooming, and oral hygiene. These tasks are vital to maintaining the dignity, health, and well-being of patients, especially those with limited mobility or illness. Activities of daily living, ADLs, encompass tasks like bathing, grooming, and oral hygiene, which are necessary for maintaining personal hygiene and overall health. For nursing assistants and healthcare workers, assisting with ADLs requires both technical skill and sensitivity to the patient's needs, preferences, and comfort. This course covers the proper techniques for providing these essential services while ensuring patient safety, dignity, and infection control. Introduction to Activities of Daily Living, ADLs. ADLs are essential tasks that support personal well-being. For many patients, particularly those with chronic illness, injury, or limited mobility, the ability to perform ADLs independently may be compromised. The basic ADLs include bathing, the process of cleaning the body to maintain hygiene and prevent infections. Grooming, tasks like hair care, nail trimming, and shaving to promote personal hygiene and comfort. Oral hygiene, brushing teeth, flossing, and caring for dentures to prevent oral infections and discomfort. Dressing and undressing, assisting patients with clothing based on their condition or preferences. Toileting, helping patients with bathroom needs, ensuring privacy and dignity. Mobility, supporting patients in moving around, whether from bed to chair or assisting with walking. For CNAs, assisting with ADLs requires careful attention to both patient needs and safety protocols. ADLs are not just about performing a task, they also ensure the patient's emotional well-being and dignity are preserved. Bathing techniques: bed, shower, and sponge baths. Bathing is a fundamental part of personal care. CNAs must be proficient in different methods of bathing depending on the patient's mobility, preferences, and medical condition. Types of bathing: bed bath, for patients unable to leave their bed. Gather necessary supplies: washcloths, towels, basin of warm water, soap, lotion. Ensure patient comfort and privacy. Use one section of the washcloth at a time, starting from the face and moving down to the feet. Provide assistance in washing the face, arms, chest, and legs, ensuring proper exposure and keeping the patient warm. Dry the body thoroughly to prevent moisture buildup, especially in skin folds. Shower or tub bath. For ambulatory or semi-ambulatory patients, ensure the environment is safe. Non-slip mats, towel rails. Use appropriate temperature settings to avoid burns or chills. Assist with positioning and provide balance support. Sponge bath, typically done for patients who can sit up but cannot shower. Use a sponge or washcloth, focusing on cleaning the patient without using a full bath. Clean the face, arms, back, chest, and legs while ensuring modesty and comfort. Key points to remember: always maintain patient privacy. Use gentle techniques to prevent skin irritation or injury. Be mindful of any medical devices, such as IVs, catheters, or oxygen tubes when bathing. Grooming: hair, nails, and skincare. Grooming is an essential part of maintaining self-esteem and comfort. Proper grooming also contributes to overall health by preventing conditions like skin breakdown or infection. Hair care: combing and brushing. Regular combing helps prevent tangling and promotes scalp health. Shampooing: for patients with hair, ensure that water temperature is comfortable and gently massage the scalp. Shaving: some patients require assistance with shaving. Always use the correct tools. Electric razor for those with sensitive skin, and ensure the patient is comfortable and safe. Nail care, trimming. Proper trimming prevents discomfort, injury, or infection. Filing and polishing. Be gentle when filing nails to prevent damage, especially in diabetics or those with poor circulation. Skincare, moisturizing. Applying lotion helps keep skin hydrated, especially in dry environments or with patients who are bedridden. Inspecting skin for signs of breakdown. Always check for pressure ulcers, redness, or sores, especially in immobile patients. Key points to remember. Always ask the patient about their preferences regarding grooming. Be gentle and cautious to prevent injury, especially for patients with frail or sensitive skin. Pay attention to signs of infection or changes in skin condition, and report abnormalities to nursing staff. Oral hygiene, proper brushing, flossing, and denture care. Oral hygiene is crucial for preventing infections, pain, and discomfort. Poor oral care can lead to periodontal disease, tooth loss, and even systemic infections like pneumonia. Steps for brushing teeth. Wet the toothbrush and apply a pea-sized amount of toothpaste. Brush all surfaces of the teeth, outer, inner, and chewing surfaces, using gentle, circular motions. Brush the tongue to remove bacteria. Use a soft, bristled toothbrush for sensitive mouths or patients with gum disease. Flossing. Use a piece of dental floss and gently insert it between the teeth. Use an up and down motion to clean the sides of each tooth and avoid snapping or forcing the floss. Denture care. Remove dentures and place them in a cup with warm, not hot water. Use a soft brush to clean the dentures, removing food particles and plaque. Ensure dentures are properly stored in a safe and clean place when not in use. Key points to remember. Encourage regular brushing and flossing to prevent gum disease. Be mindful of patients with limited mobility or dementia who may need extra assistance. Always wear gloves when handling a patient's oral care equipment, including dentures. Infection control and safety during ADL assistance. Infection control is critical when assisting with ADLs to prevent the spread of bacteria, viruses, and other pathogens. Key infection control principles. Hand hygiene. Wash hands thoroughly before and after assisting with ADLs. Gloves. Wear gloves when handling body fluids, cleaning wounds, or performing oral care. Personal protective equipment. Use PPE as required, particularly during procedures that involve body fluids. Disinfection. Ensure all grooming tools and bathing equipment are properly sanitized after each use. Ensuring safety. Always check that the environment is free of hazards. Example, wet floors, unstable furniture. When assisting with ADLs, maintain patient comfort and prevent falls by using proper techniques and equipment. Example, non-slip bath mats. Monitor for signs of discomfort, skin breakdown, or infection, and report any concerns. Cultural sensitivity and patient dignity in ADLs. Respecting patient dignity during ADL care is essential for building trust and providing compassionate care. Cultural sensitivity also plays a role in providing personalized and respectful services. Key considerations. Respect patient privacy. Always provide privacy by covering the patient appropriately and closing doors or curtains during care. Ask about preferences. Different cultures and individuals have varying expectations about personal care. Always inquire about preferences and follow them to the best of your ability. Maintain dignity. When assisting with intimate tasks like bathing or dressing, ensure the patient feels respected by explaining what you are doing, using appropriate language, and working within their comfort zone. Be non-judgmental. Foster an environment of respect and understanding, avoiding comments or behavior that might cause discomfort. CNA responsibilities in ADL care and documentation. As a CNA, you are not only responsible for providing physical assistance, but also for accurately documenting the assistance provided. Documentation guidelines. Record the type of care provided, including any changes in the patient's skin condition or physical state. Note if the patient had difficulty performing any ADLs or if there were signs of discomfort. Report any unusual findings. Example, sores, infections, excessive fatigue, to the nurse or healthcare provider immediately. Always ensure the accuracy and timeliness of your documentation, as it is a legal record that supports patient care and safety. Master the essential skills for compassionate and effective dressing, toileting, and feeding assistance to provide dignified care. This course provides essential instruction for CNAs and healthcare support workers in assisting patients with dressing, toileting, and feeding. These critical activities of daily living, ADLs, ensure the patient's comfort, dignity, and hygiene, and are foundational skills for any healthcare professional. Assisting patients with activities of daily living, ADLs, including dressing, toileting, and feeding, is a core responsibility of nursing assistants and healthcare workers. These activities help patients maintain their independence, dignity, and health, and CNAs must provide care with skill, sensitivity, and respect. This course covers proper techniques, infection control, safety considerations, and documentation practices to ensure effective and compassionate patient care. Introduction to Activities of Daily Living, ADLs, and their importance. Activities of daily living, ADLs, refer to basic tasks that are essential for maintaining personal hygiene and overall well-being. In the healthcare setting, ADLs are often provided by nursing assistants or caregivers when patients are unable to perform them independently. Core ADLs include dressing, helping the patient put on or remove clothing; toileting, assisting with using the toilet and maintaining hygiene; feeding, helping the patient eat or drink, particularly when they cannot do so on their own; bathing and grooming, maintaining hygiene through bathing, shaving, and personal grooming tasks; mobility assistance, helping patients move or reposition themselves safely. ADLs are essential for maintaining a patient's physical health, emotional well-being, and sense of independence. For CNAs, assisting with ADLs requires technical skill, patience, and sensitivity, ensuring that patients are treated with dignity and respect throughout. Dressing assistance, techniques and patient comfort. Dressing assistance is often a personal and intimate activity that requires respect for the patient's dignity. Some patients may need help due to physical limitations, cognitive impairments, or post-surgical recovery. Steps for assisting with dressing. Ensure privacy. Always provide privacy by drawing curtains or closing doors. Position the patient. Help the patient into a comfortable sitting or reclining position before beginning. Assist with clothing. Choose clothing appropriate for the patient's condition, comfort, and weather. Start with undergarments, helping the patient to insert limbs through openings. Assist with buttons, zippers, or other fasteners. Adjust for comfort. After dressing, ensure there are no wrinkles or tight spots in the clothing that might cause discomfort or pressure. Assist with footwear. Help the patient put on shoes or slippers, ensuring they are stable and comfortable. Key considerations. Always respect the patient's preferences for clothing and style. When possible, encourage the patient to participate in the dressing process to maintain their independence. Be mindful of patients with physical limitations, such as joint pain or reduced mobility, which may make dressing more difficult. Toileting assistance, maintaining dignity and hygiene. Toileting assistance is one of the most sensitive tasks in patient care. It's crucial to preserve patient dignity while providing safe and hygienic assistance, especially for those with limited mobility, cognitive impairments, or post-operative recovery. Steps for assisting with toileting. Ensure privacy. Close the door or draw curtains to provide privacy. Assist to the toilet. Depending on the patient's mobility, assist them to sit on the toilet, commode, or bedpan. Provide necessary assistance. For patients with limited mobility, help them balance or position themselves. Ensure that the patient is comfortable and secure. Provide hygiene support. After toileting, assist the patient with cleaning from front to back, especially for females, using toilet paper or wet wipes. Help with redressing. Assist the patient with lowering or raising clothing and ensuring that they are fully dressed. Ensure comfort. Make sure the patient is comfortable before leaving them and that the bathroom area is safe to navigate. Key considerations. Always wear gloves when assisting with toileting tasks. Check the skin for signs of irritation or infection, especially in areas that are in contact with moisture. Respect the patient's privacy and comfort by giving them control over the situation whenever possible. Feeding assistance. Safe practices and promoting independence. Feeding is another crucial aspect of patient care. Some patients may require assistance with feeding due to illness, injury, or cognitive impairments. It's important to promote independence while ensuring safety during mealtime. Steps for assisting with feeding. Ensure proper positioning. Position the patient upright, either in a chair, wheelchair, or bed, at a 45-degree to 90-degree angle to prevent choking. Prepare the meal. Ensure food is at a comfortable temperature and that any dietary restrictions or preferences are followed. Encourage patient participation. Encourage the patient to feed themselves as much as possible to maintain their independence. Assist with utensils. If necessary, help guide the patient's hand or provide adaptive utensils for easier grip and use. Monitor for safety. Watch for signs of choking, especially if the patient has difficulty swallowing, dysphagia. Offer small bites and sips, and encourage the patient to chew thoroughly. Provide fluids. Offer water or other liquids as needed to stay hydrated. Clean up. After feeding, clean the patient's face and hands. Dispose of any leftover food properly. Key considerations. Always ask the patient about their food preferences and respect cultural or religious dietary restrictions. If the patient has swallowing difficulties, ensure you follow proper protocols, example, thickened liquids to prevent aspiration. Be aware of any changes in appetite or eating habits, as these may indicate underlying health issues. Infection control and safety during ADL assistance. Providing ADL care requires strict adherence to infection control measures to prevent the spread of disease, particularly when assisting with toileting, feeding, and dressing. Key infection control practices. 1. Hand hygiene. Wash your hands before and after assisting with ADLs to prevent cross-contamination. 2. Gloves. Wear gloves when assisting with feeding, toileting, or when there is contact with bodily fluids. 3. Disinfect equipment. Clean and disinfect any tools or surfaces after assisting with ADLs. Example, bedpans, wheelchair trays. 4. Use PPE as needed. Wear appropriate PPE. Example, gown, mask, if the situation requires additional protection. Example, handling blood or bodily fluids. 5. Safe disposal. Dispose of any soiled materials, wipes, or pads in designated waste containers to avoid contamination. Key considerations. Be mindful of infection control protocols when assisting with feeding, particularly with high-risk patients or during meal preparation. Always ensure that the environment is clean and free of hazards that could lead to patient injury or infection. Cultural sensitivity, patient dignity, and personal preferences. Respecting patient dignity and cultural sensitivity is a core aspect of ADL assistance. Patients may have personal, cultural, or religious preferences regarding their care, and CNAs must accommodate these preferences while ensuring safe and respectful assistance. Key practices for maintaining dignity. 1. Ask for preferences. Always ask the patient how they prefer to be assisted, especially when it comes to dressing, toileting, or eating. 2. Be non-judgmental. Approach each task with sensitivity, particularly when assisting with personal care. 3. Maintain privacy. Close doors, use screens, and avoid exposing the patient unnecessarily. 4. Empathy and communication. Use compassionate communication to explain the process and reassure the patient during each task. Key considerations. Always be respectful of the patient's autonomy and preferences. Ensure comfort by using appropriate language and gestures that reinforce trust and respect. CNA responsibilities in ADL care and documentation. CNAs are responsible for assisting with ADLs and documenting their actions. Proper documentation ensures continuity of care, supports patient safety, and ensures compliance with healthcare regulations. Documentation guidelines. Record assistance provided. Log the type of ADL assistance given, including any difficulties encountered. Monitor changes. Document any changes in the patient's condition, such as skin irritation, changes in appetite, or refusal of assistance. Report issues promptly. If a patient exhibits signs of distress, discomfort, or refuses care, report it to the nurse immediately. Key considerations. Ensure all documentation is accurate, clear, and timely. Always report any concerns regarding patient health or safety to supervisory staff. Learn to effectively assess and utilize ambulation and mobility aids to support safe and confident patient mobility. This course provides essential training for CNAs and healthcare support workers on assisting patients with safe ambulation and the proper use of mobility aids. Learning these skills is vital for patient safety, comfort, and independence in a healthcare setting. Ambulation and mobility are essential aspects of patient care. Patients with limited mobility may require support to maintain or regain their independence and prevent complications like muscle atrophy, joint stiffness, or falls. This course will teach learners how to assist with safe ambulation using various mobility aids such as walkers, canes, and crutches, while focusing on proper technique, patient safety, and dignity. Introduction to Ambulation and Mobility Aids. Ambulation refers to the ability to walk or move from one location to another. Maintaining ambulation is essential for physical health, circulation, and muscle strength. However, many patients experience limited mobility due to conditions like arthritis, stroke, neurological disorders, or musculoskeletal injuries. CNAs and healthcare workers must assist patients with ambulation while minimizing the risk of injury, falls, and discomfort. Key components of ambulation assistance. Patient assessment. Before assisting with ambulation, assess the patient's ability to stand, balance, and walk. This includes checking for muscle strength, joint mobility, and any pain or discomfort that could interfere with movement. Mobility aids. Depending on the patient's needs, different mobility aids are required. These can include walkers, canes, crutches, or gait belts. Environment safety. Ensure that the patient's environment is free of obstacles, such as rugs or furniture, which could cause falls. Anatomy and physiology of movement and mobility. Understanding the body's systems involved in movement is crucial for assisting with ambulation. The musculoskeletal system, nervous system, and circulatory system all work together to enable coordinated movement and balance. Key systems involved in mobility. Musculoskeletal system. Bones, muscles, and joints provide structure, support, and movement. Proper muscle strength and joint mobility are essential for safe ambulation. Nervous system. The brain sends signals to muscles for coordination and balance. The spinal cord communicates with muscles to maintain posture and facilitate movement. Circulatory system. Circulation supports muscle function and endurance during walking. Blood flow and oxygen delivery are essential for stamina during ambulation. For CNAs, understanding these systems helps in identifying mobility issues, excerpt, weakness, pain, poor coordination, and provides insight into how to assist patients effectively and safely. Common mobility aids, types and uses. There are several mobility aids available to support patients in walking or moving. Each aid is designed to address different levels of mobility impairment, and understanding when to use each one is crucial. Types of mobility aids. Walkers. Provide maximum support and stability, particularly for patients who need assistance standing or walking. commonly used by elderly or post-surgery patients. Canes provide support for patients who need balance assistance, best for patients who have mild weakness or joint pain. Types of canes: standard cane, quad cane, four legs, and offset cane. Crutches, used by patients with limited or no ability to bear weight on one or both legs. Require good upper body strength to use correctly. Gait belts, used for patients who need assistance with walking but have some weight-bearing ability. Provides a secure hold for caregivers during ambulation and helps with safe transfers. Key considerations. Choose the right aid based on the patient's condition and physical capabilities. Adjust the height of mobility aids to ensure proper fit and comfort. Ensure the patient is familiar with the correct use of the aid before ambulation. Correct techniques for ambulation with mobility aids. Ambulation techniques depend on the type of mobility aid being used and the patient's abilities. CNAs must be proficient in guiding the patient safely while preventing falls or injury. Walkers. Ensure the walker is positioned in front of the patient for maximum stability. Patient technique. Instruct the patient to lift the walker and move it forward, then step forward into the walker. Support. Stand slightly behind and to the side of the patient to provide support if necessary. Canes. The cane should be held on the strong side of the body, opposite side of the weak leg. Instruct the patient to move the cane forward, followed by the weak leg, and then the strong leg. Support. Stand beside the patient to assist with balance as needed. Crutches. Instruct the patient to bear weight on the arms, not under the armpits, to avoid nerve damage. Use the three-point gait. Move both crutches and the injured leg forward, then swing the strong leg through. Ensure crutches are properly adjusted to the correct height to prevent strain. Gait belt. Use a gait belt to assist with walking by standing slightly behind the patient and maintaining support through the belt. Provide stability without pulling the patient and encourage them to participate as much as possible. Transferring and repositioning patients for safe ambulation. Before ambulating a patient, proper transferring and repositioning techniques are critical to ensure the patient's safety and comfort. Transferring from bed to chair. Use proper body mechanics and always lock the wheels on the bed and chair. Help the patient swing their legs over the side of the bed and sit upright before assisting them into the chair. Use a gait belt for added support and encourage the patient to participate as much as possible. Repositioning for walking. Ensure the patient is seated upright and stable before beginning ambulation. Help the patient position their feet properly and provide support as they stand up. Maintain a steady pace, walking with the patient's rhythm, and avoid sudden movements. Assisting patients with walkers, canes, and crutches. Each mobility aid requires specific techniques for effective use. CNAs must ensure that patients are using the correct technique for each aid to prevent injury and ensure comfort. Walkers. Ensure the walker is adjusted to the correct height for the patient. Instruct the patient to move the walker forward first, then step forward with the weak leg and follow with the strong leg. Canes. To ensure the cane is on the strong side of the body for balance. Instruct the patient to move the cane forward, then step forward with the weak leg, followed by the strong leg. Crutches. Adjust crutches so they are under the patient's armpits, with about 1 to 2 inches of space. Instruct the patient on proper weight-bearing techniques and support during ambulation. Safety protocols and fall prevention. Fall prevention is a critical aspect of assisting with ambulation. Falls can result in serious injuries, especially in elderly or medically compromised patients. Fall prevention strategies. 1. Assess the environment. Ensure the area is free from obstacles, rugs, or uneven flooring that could cause trips. 2. Check patient's footwear. Ensure the patient is wearing non-slip, sturdy shoes. 3. Use a gait belt. Always use a gait belt when assisting with ambulation to provide stability. 4. Monitor vital signs. Check the patient's blood pressure and pulse before standing or walking to prevent dizziness. 5. Stay close and supportive. Always walk beside or slightly behind the patient to offer immediate support if needed. CNA responsibilities in ambulation and mobility aid use. CNAs play a key role in promoting patient independence while ensuring safety during ambulation. Their responsibilities include providing assistance with mobility, ensuring the correct use of mobility aids, and documenting progress. Documentation guidelines. Record assistance provided. Document the type of mobility aid used, any difficulties encountered, and the patient's response to ambulation. Report abnormalities. If the patient experiences pain, dizziness, or refuses to walk, document these observations and notify the nurse. Update care plan. If the patient's mobility needs change, report these changes to the healthcare team to adjust the care plan accordingly. Learn how to truly make a difference by mastering the art of promoting independence and dignity in every interaction. This course is focused on the key principles of promoting patient independence and preserving dignity, essential skills for nursing assistants and healthcare workers to provide compassionate and respectful care to patients. Promoting independence and dignity is at the core of patient-centered care. Nursing assistants, CNAs, and healthcare support workers are often in a position to help patients perform daily activities, but this assistance must always be provided in a way that respects the patient's autonomy and personal dignity. This course covers key strategies for maintaining patient independence, respecting personal choices, and empowering patients in their care. It also emphasizes practical methods to balance patient safety and comfort with respect for their rights. Understanding the importance of promoting independence and dignity. Promoting a patient's independence is a fundamental part of fostering self-esteem, autonomy, and dignity. When patients feel that they are in control of their decisions and their daily activities, they are more likely to experience emotional well-being and physical recovery. The benefits of promoting independence include enhanced self-worth. Encouraging patients to perform tasks on their own helps them feel valued. Improved physical health. Active participation in self-care activities supports better physical and cognitive function. Emotional well-being. Retaining control over one's care fosters a sense of empowerment and dignity. Reduced dependency. Helping patients retain as much autonomy as possible prevents long-term reliance on caregivers. For CNAs, promoting independence involves finding the balance between supporting patients and allowing them to engage in their own care routines as much as possible. It's about offering assistance when necessary, but not imposing help when the patient can do the task themselves. Respecting autonomy in patient care. Respecting a patient's autonomy means allowing them to make decisions about their care. Autonomy refers to the patient's right to choose their actions and decisions based on their personal values and beliefs. Key points to consider. Patient rights. Every patient has the right to make decisions about their own care, including the right to refuse treatments, medications, or procedures. CNAs should encourage patients to express their preferences and actively listen to their concerns. Encouraging informed decision-making. Patients should be given clear, concise, and accurate information to help them make informed decisions about their health. As a CNA, your role is to provide assistance with the practical aspects of care, but also to empower the patient to make their own choices. Respect for personal beliefs. Different cultures and individuals may have varying perspectives on care. CNAs should be sensitive to these differences and respect personal beliefs regarding treatment or preferences for care practices. Communication skills for empowering patients. Effective communication is central to promoting patient independence and dignity. The way CNAs communicate with patients can significantly influence how patients feel about their care and their role in the decision-making process. Key communication strategies include active listening. Listen to the patient without interrupting, ensuring they feel heard and valued. Use body language, like nodding, to show attentiveness and empathy. Clear and simple language. Use plain language when explaining tasks or treatments to patients. Avoid medical jargon unless the patient is familiar with it. Respectful communication. Address patients respectfully, using their preferred name or title. Encourage open-ended questions to invite the patient's opinions or preferences. Nonverbal communication. Be aware of your body language. Maintain eye contact and use a calm and respectful tone of voice. Pay attention to the patient's body language and nonverbal cues, which can often communicate their needs or discomfort. Supporting patients with activities of daily living, ADLs. Assisting with activities of daily living, ADLs, such as bathing, dressing, toileting, and feeding, can be an opportunity to promote a patient's independence. While it may be necessary to help patients with these activities, CNAs must focus on promoting the patient's autonomy within the care process. Involving patients in decision-making helps patients feel more in control of their care, which can positively impact their recovery and overall satisfaction with care. Ways to involve patients in decision-making. 1. Ask for preferences. Always ask the patient how they would like to be cared for, whether it's about their environment, treatment, or ADL preferences. 2. Offer choices. Provide options whenever possible. For example, offer different methods of bathing, shower versus bed bath, or meal options based on the patient's dietary restrictions. 3. Encourage participation. If a patient is able, encourage them to assist in their care, such as brushing their own teeth or choosing their clothes for the day. Building trust and rapport in patient care. Trust and rapport are essential for fostering a collaborative and empowering relationship between the patient and CNA. Building these qualities can enhance the patient's emotional well-being and encourage participation in their care. Key strategies for building trust and rapport. Consistency. Be consistent in your interactions with patients. Being dependable and following through on promises builds trust. Empathy. Show empathy by acknowledging the patient's feelings and offering support. For example, if a patient expresses frustration about their condition, offer comforting words and actively listen. Respecting boundaries. Always respect patient boundaries and preferences. If a patient is uncomfortable with a specific task, try to find an alternative or provide reassurance and support. Positive reinforcement. Offer praise and encouragement when patients take steps toward independence, such as dressing themselves or making decisions about their care. Addressing challenging situations while maintaining dignity. In healthcare settings, CNAs may encounter patients who are resistant to care, refuse assistance, or exhibit challenging behavior due to their condition. Handling difficult situations while preserving dignity. 1. Patient refusal. Respect the patient's decision to refuse care unless it poses a risk to their health. In such cases, explain the consequences of refusal and involve other healthcare professionals as needed. 2. Behavioral challenges. Patients with cognitive impairments or mental health conditions may be non-compliant or confused. Stay calm and use simple explanations to help them understand their care needs. 3. Maintaining privacy. Ensure privacy during all tasks, especially when dealing with personal care needs. Even when the patient refuses care, maintaining privacy reinforces dignity. CNA responsibilities in promoting independence and dignity. As a CNA, it's your responsibility to ensure that the care you provide always supports the patient's independence and dignity. This requires you to communicate effectively, respect the patient's choices, and adapt care routines to meet the patient's individual needs. Key CNA responsibilities include 1. Advocating for patients. Speak up if a patient's preferences are not being considered by the healthcare team. Be an advocate for their right to participate in their own care decisions. 2. Accurate documentation. Document all patient preferences, refusals, and changes in condition accurately and promptly. 3. Continuous learning. Regularly participate in training and professional development opportunities to improve your communication and caregiving skills. By maintaining a focus on patient autonomy and dignity, CNAs help ensure patients receive respectful, compassionate, and individualized care.
Learn to build stronger connections and promote healthier responses through the art of supporting emotional needs. This course provides essential instruction for CNAs and healthcare support workers on how to recognize, understand, and support the emotional and psychological needs of patients in various healthcare settings. Understanding and supporting a patient's emotional health is crucial to providing compassionate, comprehensive care. This course provides essential instruction for CNAs and healthcare support workers on how to recognize, understand, and support the emotional and psychological needs of patients in various healthcare settings. Understanding and supporting a patient's emotional health is crucial to providing compassionate, comprehensive care. Understanding the emotional needs of patients. Patients often face emotional challenges related to their physical health conditions. These challenges can include anxiety, fear, depression, anger, and frustration, all of which can affect their recovery and overall well-being. Emotional needs of patients include fear and anxiety. Patients may worry about their health, diagnosis, or treatment outcomes. Depression. Chronic illness, pain, and uncertainty about recovery can lead to feelings of sadness or hopelessness. Anger and frustration. Patients may feel upset about their illness or the restrictions placed on them due to their condition. Loneliness and isolation. Long hospital stays or homebound conditions can lead to feelings of loneliness, especially for elderly patients or those without a strong support network. As a CNA, you will be the first to observe changes in a patient's emotional state and must be able to recognize signs of emotional distress. Understanding the patient's emotional needs is key to providing effective care. The role of empathy and compassion in healthcare. Empathy is the ability to understand and share the feelings of another person, while compassion goes a step further by acting to alleviate their distress. Both qualities are essential when providing patient care, as they foster trust, rapport, and comfort in the patient-caregiver relationship. How to practice empathy and compassion. Listen actively. Pay attention to the patient's words, tone, and body language. Validate their emotions by acknowledging their feelings. Be non-judgmental. Allow patients to express themselves without fear of criticism or dismissal. Respond with compassion. Offer words of encouragement or reassurance when a patient expresses fear, pain, or frustration. Simple statements like, "I understand this is difficult for you," can go a long way. Respect boundaries. Recognize when a patient needs space or prefers not to talk. Offer support when they are ready. As a CNA, showing empathy and compassion can ease emotional distress, improve patient satisfaction, and contribute to a healing environment. Effective communication techniques for emotional support. Effective communication is essential when supporting patients emotionally. CNAs must understand how to communicate clearly, compassionately, and respectfully with patients to foster a sense of safety, dignity, and trust. Key communication techniques include active listening. Listen attentively and avoid interrupting. Acknowledge the patient's feelings by reflecting back what they have said. It sounds like you're feeling worried about your treatment. Nonverbal communication. Pay attention to body language, eye contact, and tone of voice. Your nonverbal cues can offer reassurance or indicate that you are genuinely engaged. Open-ended questions. Encourage patients to share their thoughts and feelings by asking questions that require more than a yes/no answer. Example, how are you feeling today? Or, can you tell me more about what's on your mind? Providing reassurance. When appropriate, reassure the patient that their concerns are valid and that the healthcare team is there to support them. Empathy, clear communication, and attentive listening help CNAs understand emotional distress and provide support accordingly. Supporting patients through chronic illness and recovery. Chronic illness and recovery from surgery or acute illness often involve ongoing emotional challenges. Patients may struggle with uncertainty, pain, fatigue, and decreased independence, which can impact their emotional well-being. Supporting chronic illness patients. Encourage self-management. Teach patients how to manage their condition and celebrate small successes. Example, improved mobility, better pain control. Provide emotional support. Acknowledge the challenges of living with chronic conditions and reassure patients that they are not alone in their journey. Promote independence. Encourage the patient to maintain as much independence as possible, whether it's through mobility aids, daily care tasks, or decision-making. Manage expectations. Set realistic goals for the patient's recovery or management of their illness, avoiding false hope or undue pressure. Supporting recovery. Monitor emotional changes. Be aware of signs of depression or anxiety during the recovery phase. Encourage patients to express concerns about their recovery. Create a supportive environment. Encourage family involvement and ensure the patient feels comfortable and well cared for during their recovery. Dealing with end-of-life care and grief. End-of-life care can be emotionally taxing for both patients and their families. As a CNA, you will be involved in caring for terminally ill patients and may also interact with their grieving families. Providing support for end-of-life patients. Create a peaceful environment. Ensure the patient is comfortable and their wishes regarding pain management and family visits are respected. Offer a listening ear. Sometimes, family members or patients need someone to listen to their concerns, fears, and reflections. Respect patient wishes. Help facilitate discussions about advanced directives or end-of-life care preferences, ensuring the patient's dignity is upheld. Supporting the grieving process. 1. Be present. Sometimes, offering emotional support simply means being there for the patient or family. 2. Acknowledge grief. Understand that grief can manifest in many ways, example, anger, sadness, denial, and allow family members to express their feelings. 3. Offer resources. Provide information about grief counseling or support groups if needed. Providing emotional support in mental health care. Patients with mental health conditions, example, depression, anxiety, schizophrenia, often have unique emotional needs. CNAs must be prepared to offer care and support that is compassionate and non-judgmental. Key strategies for supporting mental health patients. 1. Recognize signs of emotional distress. Look for indicators such as withdrawal, irritability, or signs of agitation. 2. Create a calm environment. Avoid overstimulation and try to keep the environment peaceful and quiet for patients experiencing anxiety. 3. Encourage positive self-talk. Help the patient reframe negative thoughts by focusing on their strengths and accomplishments. 4. Respect boundaries. Some mental health patients may need more personal space, while others may benefit from social interaction. Always ask and respect their preferences. Recognizing and managing emotional distress in patients. Emotional distress can take many forms, including anxiety, depression, anger, and fear. Recognizing these signs early can prevent more serious emotional or physical issues and allow the healthcare team to intervene appropriately. Signs of emotional distress. Physical symptoms: increased heart rate, sweating, tremors, or fatigue can indicate anxiety or fear. Behavioral changes: withdrawal, irritability, or changes in eating or sleeping patterns can signal depression or stress. Verbal cues: expressions of hopelessness, fear, or frustration can reveal emotional distress. Managing emotional distress. 1. Listen actively. Allow the patient to express their feelings and show understanding. 2. Provide reassurance. Offer gentle reassurance and comfort. 3. Encourage coping strategies. Guide the patient toward relaxation techniques or mindfulness to reduce anxiety. 4. Involve the healthcare team. If the distress is severe, inform the nursing staff or counselor to address underlying issues more effectively. CNA responsibilities in supporting emotional needs and documentation. As a CNA, your role in supporting emotional needs is crucial. Your observations and actions can significantly impact patient care and well-being. Documenting emotional care interventions ensures accurate communication and helps inform the overall care plan. Key CNA responsibilities. 1. Observe and report. Be vigilant in monitoring any changes in the patient's emotional state and report these to the nurse or healthcare team. 2. Support patient communication. Encourage patients to express their feelings and document any significant changes or concerns. 3. Maintain confidentiality. Always respect patient privacy and confidentiality, particularly when dealing with sensitive emotional or psychological matters. 4. Document emotional interventions. Ensure that any emotional support you provide is documented in the patient's care plan, along with any observed changes in mood or behavior. Explore vital insights and coping mechanisms for effectively dealing with anxiety, dementia, and depression, fostering well-being and resilience. This course focuses on the emotional and psychological needs of patients dealing with anxiety, dementia, and depression. CNAs and healthcare workers will gain essential skills and knowledge to provide compassionate care and support for these patients. Anxiety, dementia, and depression are common psychological conditions in healthcare settings, often affecting patients' ability to engage in their care and interact with others. As CNAs, understanding how to identify these conditions, communicate effectively, and provide appropriate support can significantly improve a patient's quality of life. This course covers key concepts, strategies, and techniques to assist patients with anxiety, dementia, and depression while promoting dignity, safety, and emotional well-being. Understanding anxiety, dementia, and depression. Understanding these conditions is crucial for providing appropriate care and ensuring the patient's comfort. Anxiety. Anxiety is a feeling of fear or worry about a perceived threat. It can manifest as restlessness, increased heart rate, and difficulty concentrating. It often results from stress, medical conditions, or environmental changes. Dementia. Dementia is an umbrella term for a variety of conditions that impair cognitive functioning, including memory, communication, and decision-making. Alzheimer's disease is the most common form of dementia, characterized by gradual memory loss and confusion. Depression. Depression is a mental health condition characterized by persistent sadness, loss of interest in activities, and difficulty concentrating. It can lead to physical symptoms such as fatigue, changes in appetite, and difficulty sleeping. Key points. Anxiety often responds to relaxation techniques or cognitive behavioral strategies. Dementia requires structured routines and familiar environments to reduce confusion. Depression may require emotional support, encouragement, and sometimes medical intervention. Recognizing signs and symptoms. Recognizing the signs and symptoms of anxiety, dementia, and depression is crucial for CNAs in providing timely care and support. Signs and symptoms of anxiety: restlessness or nervousness, rapid heart rate or breathing, difficulty concentrating or focusing, complaints of physical symptoms, example, headaches, stomach aches. Signs and symptoms of dementia: memory loss, example, forgetting names, appointments, or locations, difficulty communicating or finding the right words, disorientation to time and place, poor judgment and decision-making skills, behavioral changes such as agitation, aggression, or withdrawal. Signs and symptoms of depression: persistent sadness or empty feelings, loss of interest in activities once enjoyed, changes in appetite or sleep patterns, difficulty focusing or making decisions, physical symptoms like fatigue or aches without clear cause. By observing these signs, CNAs can intervene early and ensure appropriate care for patients struggling with anxiety, dementia, or depression. Effective communication strategies for anxiety, dementia, and depression. Effective communication is key to providing emotional support for patients experiencing anxiety, dementia, or depression. Adapting communication strategies based on the patient's condition will reduce stress and create a more supportive environment. For anxiety, use calm, reassuring tones. Speak slowly and offer reassurance. Help the patient focus on their breathing. Encourage deep breathing exercises. Deep breathing can help regulate the patient's physical symptoms and reduce panic. Validate feelings. Acknowledge the patient's anxiety and avoid dismissing their concerns. Keep instructions simple. Give short, clear instructions and avoid overwhelming the patient. For dementia, use simple, clear language. Patients with dementia may have difficulty processing complex information. Use short sentences and clear instructions. Avoid correcting the patient. Correcting them can cause frustration. Instead, gently redirect or offer reassurance. Provide familiar cues. Maintain routines, use familiar names or objects, and ensure the patient feels comfortable and safe. Be patient and allow extra time. Give the patient time to process information and respond. For depression, offer a listening ear. Sometimes the patient just needs someone to talk to. Let them express their feelings without judgment. Encourage small steps. Help the patient set small, achievable goals for their day, such as getting out of bed or eating a meal. Avoid offering unsolicited advice. Simply offering a comforting presence is often more helpful than trying to fix the situation. Providing comfort and reassurance to anxious patients. Anxiety can be debilitating for patients, affecting both their physical and mental health. Providing comfort and reassurance is essential to helping the patient feel supported and secure. Techniques for reassurance. Calm presence. Your presence alone can provide comfort. Remain calm and composed to model a sense of control. Redirect attention. Help the patient focus on something calming, like a soothing image or a favorite object. Breathing exercises. Encourage slow, deep breaths to help the patient calm down. You can guide them through the steps or simply demonstrate. Distraction. Engage the patient in light conversation, music, or a favorite hobby to shift their focus from anxiety-provoking thoughts. Caring for patients with dementia, techniques for safety and engagement. Patients with dementia face challenges with memory, cognition, and behavior, making it essential to maintain a structured, safe environment that supports their needs. Techniques for supporting dementia patients. Routine and structure. A consistent routine helps reduce confusion and anxiety. Ensure regular meal times, medication schedules, and sleep routines. Safety modifications. Ensure the environment is free of obstacles or hazards. Use safety devices like bed alarms to prevent wandering. Engagement. Encourage activities that engage the patient's cognitive abilities, such as puzzles, memory games, or reminiscing about past events. Monitor behavior. Be aware of mood changes, such as agitation or aggression, and have strategies to address these behaviors safely. Supporting patients with depression. Emotional and practical care. Depression can deeply affect a patient's mental and physical health, making it harder for them to care for themselves or find joy in life. Providing emotional and practical support is crucial. Supporting depression. Listen and validate. Offer a listening ear and let the patient express their feelings without judgment. Acknowledge their emotions and provide reassurance. Encourage self-care. Encourage basic activities such as personal hygiene, eating, or getting out of bed. Set small, manageable goals. Assist with daily tasks. Offer help with ADLs, dressing, feeding, etc., but encourage the patient to do as much as possible independently. Monitor for suicidal ideation. Be vigilant for signs of depression that may indicate suicidal thoughts. If the patient shows signs of suicidal ideation, immediately inform the nursing staff. Ethical considerations and cultural sensitivity in mental health care. Dealing with patients who have anxiety, dementia, or depression requires not only medical knowledge, but also sensitivity to the ethical and cultural aspects of care. Key ethical considerations. Autonomy. Respect the patient's right to make decisions about their care, even if their choices differ from what healthcare providers would recommend. Confidentiality. Maintain the patient's privacy, especially when discussing sensitive mental health information. Informed consent. Ensure that patients with mental health conditions understand their care options and are involved in decisions. Cultural sensitivity. Understand cultural differences. Be aware that patients from different cultural backgrounds may have different views on mental health and treatment. Respect their beliefs and preferences. Tailor care to individual needs. Adapt care strategies based on the patient's cultural and personal preferences, ensuring they feel comfortable and respected. CNA responsibilities in managing anxiety, dementia, and depression. As a CNA, your role includes providing direct care, reporting observations, and ensuring the emotional and psychological well-being of the patient. Key CNA responsibilities. Observation. Monitor patients for signs of anxiety, dementia, and depression. Report any significant changes in their behavior or mental state. Provide support. Offer emotional comfort, encouragement, and assistance with ADLs. Help patients feel safe, heard, and supported. Document care. Accurately document any emotional or psychological care interventions, noting changes in the patient's condition and any strategies used to manage their symptoms. Advocate for the patient. Be an advocate for the patient's needs, ensuring their emotional well-being is considered in the overall care plan.